Welcome to another deep dive into the future, everyone. Today we're taking on healthcare, but not the kind you're used to. Forget robot surgeons, we're talking about a whole new system.
Yeah, a complete reimagining of healthcare.
We got our hands on this document, and it lays out a post-singularity unified health ecosystem, and I have to admit, even saying it is a mouthful.
It's a mouthful, sure, but it's some pretty mind-blowing stuff.
And that's why you're here, to help us break it down.
Happy to be here.
But before we get too deep, I think we need to clarify something. When people hear singularity, they often think it's just about, like, computers getting super fast.
Right, faster processing, more data,
But this document seems to be talking about something bigger.
much bigger. It's not
Mhm.
just about speed, it's about intelligence. We're talking about a point where artificial intelligence surpasses human capabilities.
And what does that mean for healthcare specifically?
Well, imagine a future where we can predict and prevent diseases before they even show symptoms, where treatments are tailored to your unique genetic code, where aging itself might become a thing of the past.
Okay, now you're just messing with me.
I'm serious. This document lays out a roadmap for a future where technology could fundamentally reshape our understanding of health and longevity.
This unified health ecosystem, can you break that down for me? What's the core concept here?
It's all about interconnectedness. It's about AI, nanotechnology, and biotechnology all working together seamlessly to monitor, predict, and optimize your health throughout your entire life.
So instead of just treating us when we're sick, this system is designed to keep us healthy in the first place.
Exactly. It's about shifting from a reactive approach to healthcare to a proactive one. It's about prevention and early intervention, all guided by the power of AI.
And part of this system, this document mentions AI doctors. Now, are we talking about algorithms making life or death decisions here?
That's a bit of an oversimplification. It's not about replacing doctors entirely, but about augmenting their capabilities with AI. Think of it as a highly advanced physician's assistant that can analyze massive data sets, identify patterns, and make recommendations.
So AI as a tool for doctors, not a replacement.
Exactly. This document specifically mentions AGI, which stands for Artificial General Intelligence. It's not just about performing specific tasks like those specialized AI we have today. We're talking about an AI that can understand and reason like a human doctor, but with access to a vast amount of information and processing power that we can't even comprehend.
So no more misdiagnoses, no more trial and error with treatments.
Theoretically, yes. Imagine going to the doctor and receiving a treatment plan tailored to your specific genetic makeup, your lifestyle, your environment. It's about personalized medicine taken to a whole new level.
Okay, now this is where it gets really sci-fi for me. This document talks about nanobots, like tiny robots in our bloodstreams fighting diseases.
It sounds like science fiction, but the potential is there. We're talking about microscopic machines capable of delivering drugs directly to cancer cells, repairing damaged tissues at the cellular level, even clearing arteries from the inside.
So we're talking about curing diseases that are considered incurable today.
Potentially, yes. Nanotechnology has the potential to revolutionize the way we treat a wide range of diseases, from cancer and heart disease to Alzheimer's and Parkinson's. It could even allow us to repair damage at the cellular level, essentially slowing down or even reversing the aging process.
Hold on, hold on. I thought we were talking about nanobots. Now we're talking about reversing aging.
It's all connected. One of the most exciting applications of these technologies is the creation of digital twins.
Digital twins? What in the world are those?
Imagine a virtual replica of your body, a digital twin created using your health data. Doctors could use this simulation to test treatments, predict your body's response, and develop personalized interventions, all without any risk to you.
So it's like running simulations on a computer before you try anything in real life.
Exactly. But it goes even further. The document suggests that AI could use your digital twin to simulate the aging process, identifying potential health problems decades in advance.
Yeah.
We're talking about predicting and preventing diseases before they even manifest.
This is getting pretty intense. This isn't just about treating illnesses anymore. We're talking about redefining what it means to be healthy, to age, maybe even to die.
You're right, this isn't just about healthcare. It's about the future of humanity.
Right.
And with any profound technological advancement, it's crucial that we proceed with caution and consider the ethical implications.
And trust me, we will get to those ethical questions. But before we do, I want to dig deeper into the practicalities of this unified health ecosystem. What would it actually look like to receive healthcare in this brave new world?
It's quite a shift from what we're used to. It really is. We're not just talking about new treatments. We're talking about a completely new healthcare landscape.
The document mentions something about decentralized automated systems, so no more giant hospitals.
Not necessarily. Hospitals would still exist, but they might not look anything like they do today. Imagine smaller, more specialized facilities spread throughout communities, connected by a sophisticated network powered by AI.
So instead of one massive hospital for an entire city, we'd have smaller clinics in every neighborhood.
Exactly. These local clinics would act as the first point of contact, equipped with advanced diagnostic tools, many of which would be automated.
Okay, walk me through this. What would it be like to actually go to one of these clinics?
Well, imagine walking into a clinic, and instead of checking in with a receptionist, you interact with an AI-powered kiosk. You describe your symptoms, maybe answer a few questions, and the system directs you to the appropriate diagnostic tools.
And these diagnostic tools, they'd be automated too.
Many of them, yes. Meet a blood test. A robotic arm takes your sample with incredible precision. Suspect you might have a fracture. An advanced imaging system gives you a 3D model of your bones in minutes.
So no more waiting days or weeks for test results. We could get diagnoses on the spot.
In many cases, yes. And if your situation requires a specialist, these clinics would have the capability to connect you remotely with experts in real time.
Wait a minute, are we talking about telesurgery here? Because the thought of a robot performing surgery on me, even with a human controlling it, is a little unnerving, to say the least.
It's understandable to have some reservations about that, but robotic surgery is already being done today, and these systems are designed to be incredibly precise and efficient, minimizing the risk of complications. And in this future we're discussing, it's not just about the robots themselves, but about connecting those robots to the world's best surgeons, no matter where they happen to be located.
So theoretically, a world-renowned heart surgeon could operate on someone in a remote village, all through a robotic avatar.
Exactly. It's about democratizing access to healthcare in a way that's simply not possible with our current system.
That's incredible. But let's be realistic for a second. Wouldn't all this technology be insanely expensive? I mean, we're already struggling to afford healthcare as it is.
That's a valid concern. But here's the thing. This document argues that the efficiencies we'd gain through automation and AI-driven resource management could actually make healthcare more affordable in the long run. Imagine a world where preventative care is so effective that the need for expensive treatments is drastically reduced.
So instead of paying for expensive surgeries and long-term care down the road, we'd be investing in a system that helps us stay healthy in the first place.
Precisely. It's about shifting our focus from treatment to prevention, which is not only more effective, but potentially much more cost-effective as well.
That makes sense. But what about the human cost? All this automation, wouldn't that lead to massive job losses in the healthcare industry?
It's true that some jobs, particularly those that are repetitive or data-heavy, might become automated. But this document envisions these changes happening alongside the creation of entirely new jobs in fields like AI development, data analysis, and remote healthcare management.
So it's not just about replacing humans with machines, it's about humans and machines working together.
Exactly. And not just working together, but augmenting each other's capabilities. For example, imagine AI handling tasks like data entry, appointment scheduling, even initial diagnoses, freeing up doctors and nurses to spend more time with patients, focusing on things that require empathy, critical thinking, and a human touch.
I like that. Technology taking care of the busy work so that medical professionals can focus on the human element of care. It's not just about treating diseases, it's about caring for people.
Absolutely. And speaking of human touch, we can't forget about telemedicine. Imagine a world where you can have a doctor's visit from the comfort of your own home with all the benefits of advanced technology at your fingertips.
I've done telemedicine appointments before, and they're definitely convenient, but how would it be different in this post-singularity world? What makes it more than just a video chat with your doctor?
Imagine telemedicine platforms that are seamlessly integrated with all of your health data, from wearables to electronic health records, even genetic information. You put on a pair of augmented reality glasses, and your doctor can see inside your body in real time, guiding you through a virtual examination as if they were right there with you in the room.
Okay, now that's just wild. I can definitely see the benefits, especially for people in remote areas or those who have difficulty getting to a doctor's office. But it also feels a little intrusive. All that data being collected and analyzed. What about privacy?
That's an incredibly important consideration. This vision of the future relies heavily on data, there's no doubt about that. But this document emphasizes the need for stringent security measures and strict ethical guidelines for how AI is used in healthcare. It's about patients having complete control over their own data, deciding what's shared and with whom.
So transparency and empowerment, not exploitation.
Exactly. It's about ensuring that these technologies are used responsibly and ethically to benefit patients, not to exploit them.
I'm glad to hear that. But we've been talking a lot about physical health. What about mental health? Does this document address the mental and emotional well-being side of things?
It does. In fact, it suggests that AI could be a powerful tool for improving mental health care, especially in terms of accessibility and personalization. Imagine, for example, virtual therapists powered by AI, available 204/7 to provide on-demand counseling and support.
That could be a game changer, especially with how difficult it can be for people to access mental health services these days. But can AI truly understand the complexities of human emotions? I mean, there's a big difference between identifying a pattern in data and providing genuine emotional support.
That's a question that a lot of people are asking, and rightly so. But even if AI can't fully replicate human empathy, it can still be a valuable tool for augmenting human therapists, providing them with insights and support so that they can focus on what they do best, connecting with their patients on a human level.
That makes sense. This deep dive has really opened my eyes to the incredible potential of AI in healthcare. We've talked about how it could transform everything from disease diagnosis and treatment to healthcare delivery and even the very nature of our healthcare system. But there's one thing we haven't really touched on yet, the economic implications of all of this.
You're right. We've talked about how AI could make healthcare more efficient and effective. But what about affordability? What happens to healthcare costs when we enter a world where resources are no longer scarce?
That's a big question, and one that I'm not sure I even know how to begin to answer.
Well, this document actually offers some intriguing possibilities. It suggests that this shift to a post-scarcity model, driven by AI and automation, could fundamentally change the way we think about healthcare economics.
It's a lot to wrap your head around, right? This idea of a post-scarcity healthcare system where resources are abundant and everyone has access to the best care imaginable. It feels almost utopian.
It's a radical concept, no doubt. But this document makes a compelling case that it might not be as far-fetched as it seems, thanks to the power of AI and automation.
Okay, but how exactly does AI create this abundance? We've talked about efficiency, but can you give me some concrete examples of how AI could make healthcare resources as readily available as, say, clean water?
Imagine a system where AI manages virtually every aspect of the healthcare supply chain, from the manufacturing of medications and medical equipment to the allocation of hospital beds, and even the scheduling of appointments.
So we're talking about a completely optimized system with no waste and no shortages.
That's the idea. Imagine AI anticipating drug shortages before they happen, optimizing hospital staffing levels based on real-time needs, even personalizing the manufacturing of medications to match individual patient data. We're talking about a level of precision and efficiency that's simply not possible with our current systems.
That sounds incredible, but also incredibly complex. How would an AI even begin to manage something so intricate?
By analyzing massive amounts of data. And remember, we're not just talking about medical records here. We're talking about data from wearables, social media, environmental sensors, even economic indicators. By analyzing all of this data, AI could identify patterns and make predictions about future healthcare needs with a level of accuracy that we've never seen before.
So AI could, for example, predict the outbreak of a new virus before it even happens.
Precisely. Imagine a global network of AI systems constantly analyzing data from all over the world, weather patterns, travel itineraries, social media posts, you name it. If there's a new virus emerging somewhere, this AI network could potentially detect it in its earliest stages, predict its spread, and even identify those most at risk, allowing for targeted interventions and potentially preventing a full-blown pandemic.
That's incredible, but also a little scary. All that data being collected and analyzed, it feels like we're venturing into some pretty ethically ambiguous territory. What about privacy?
It's a valid concern, no doubt, and it's something that this document addresses directly. It emphasizes that any system that relies on this level of data analysis would need to have incredibly robust privacy safeguards built in from the ground up.
What would those safeguards look like?
Well, for starters, we're not talking about some government agency having access to your every move or medical record. We're talking about a secure, decentralized system where individuals have complete control over their own data.
So I would get to decide what data is shared and with whom.
Exactly. It's about empowering individuals, not exploiting them. Transparency and control are essential.
Okay, that makes me feel a little better. But let's talk about the elephant in the room. Building this kind of system, even if it does lead to a healthier, more equitable future, would require a massive upfront investment. Who's going to pay for all of this?
That's a question that a lot of people are asking. But the document actually offers an interesting perspective on this. It argues that the shift to a post-scarcity model could fundamentally change the way we finance healthcare in the first place. Right now, we spend trillions of dollars each year treating diseases, many of which are preventable.
So we're essentially paying for our broken system, which is incredibly inefficient and often ineffective.
Exactly. But in a world where AI is helping us stay healthy longer, where chronic diseases are either caught early or prevented altogether, the entire economic model of healthcare could shift. We could potentially move from a system focused on treatment to one focused on prevention, which is not only more effective, but potentially much more cost-effective in the long run.
So instead of paying for expensive surgeries and long-term care, we'd be investing in a system that keeps us from needing those things in the first place. It's an investment in our collective health and well-being.
Precisely. And if healthcare costs decrease dramatically, as this document suggests, it could free up resources for other pressing societal needs. We could invest more in education, infrastructure, research and development, even things like universal basic income. This isn't just about healthcare. It's about creating a more just and equitable society for everyone.
This whole conversation has been mind-blowing, really. We've gone from talking about tiny robots in our bloodstreams to reimagining the entire healthcare system and even society as a whole.
It's a lot to take in, but that's the thing about exploring the future. It has a way of expanding our perspective and challenging our assumptions.
It certainly has. So where do we go from here? What's the next step?
Well, I think the first step is to keep asking questions, to keep the conversation going. We need to talk about these possibilities, explore the potential benefits and challenges, and most importantly, figure out how to ensure that these technologies are developed and implemented responsibly and ethically.
I completely agree. This isn't just about technology. It's about our values, our priorities, and what kind of future we want to create.
Exactly. The future of healthcare isn't predetermined. It's something that we get to decide collectively.
Well said. I want to thank you for joining me on this deep dive. It's been an incredible journey and one that I think will stay with me for a long time.
Me too. And everyone listening, thank you for joining us on this exploration of the future of healthcare. The conversation is far from over, and we encourage you to continue exploring these ideas and asking these important questions. Until next time, stay curious.